I'm Dr. Sheldon from Advanced Pet Care of Oakland, and we're going to show you today what a wellness exam is and what that includes and everything we do for those normal appointments. So when you first get here, a technician will call you into a room, and we have rooms that are more set up for big dogs, little dogs, and then we have some for cats and exotics as well. This is our big dog room, so we'll show you how to use the big scale and everything that we use. The technician or assistant will call you in, and you'll get a temperature taken on your pet. We'll do a pulse, which is a heart rate, and then a respiratory rate as well, and make sure those things are all normal before we proceed. And this is Jack. He is our volunteer for the day. Come here, Jack. Come on up. He graciously volunteered to be examined today. So this is our big scale. It's a scale, but it's also an exam table. So if we have a large dog, for him we don't really need it, but for the large dogs, that way, if it's a 100-pound dog, we don't have to lift him up and scare him. So what we normally do is first we'll just get a brief history from you, the owner, make sure you don't have any questions or concerns that need to be addressed at your visit, and then we'll do a head-to-tail exam on the dog or cat. So what I usually do is I'll start with their head or their face, and I'll just look at their eyes, I'll look at their nose, just an overall quick exam of their face, and we'll look at each area in particular. But I just look and make sure that there's no sign of any redness or discharge in their ears. They don't have anything abnormal with their eyes, excessive discharge, or anything with their eyelids abnormal. We'll look at their nose and make sure their nose is normal, no discharge. And then we'll also look in their mouth. Actually, I'm going to raise him up just a little bit more. He's a little small. Good boy. Good boy. So we'll actually open their mouth up and then take a look at their teeth. So we'll look for any tartar, any redness, any masses, any fractures or chips to their teeth. And we go around and we look at all their teeth. And then we'll also try to open their mouth and kind of look at their tongue and everything as well. Then what I usually do is I'll actually feel their lymph nodes, and a lot of times owners think that we're just petting them, but we're actually feeling as we go. So they have lymph nodes right here under their neck that I'll feel for. They have some right here where their shoulder blades come in, and I'll feel for those. And I'll just kind of run my hands down their legs and body, looking for any lumps or bumps or anything out of the ordinary. And then when I get to the abdomen, I kind of feel in there, push in there. I look to feel if I feel any organ enlargement, once again, any lumps or bumps or anything out of the ordinary, if they're painful, anything like that. And then I'll just kind of go down along each leg to feel those. They have lymph nodes back here as well that I'll look at. And then we'll look at their feet, make sure their nails don't need to be trimmed, anything like that. And then we'll look at their little back area, check to see if they're, boy, girl, make sure that their rectal area and everything looks normal. If they're having any orthopedic problems or limping problems, we'll do a more in-depth orthopedic exam. We don't always do that for just a wellness visit unless there's any, special concern. Then I'll go in more depth with my exam. So first use the ophthalmoscope to look at their eyes. And normally we'll turn off the lights sometimes to do this, but obviously you wouldn't be able to see me if I did that. Stay, baby, stay, stay. So we'll actually look at each eye. We look at their iris, their lens, their retinas. So we do a full exam of each eye just to make sure we don't see cataracts or anything abnormal on the inside of the eye. And everything looks good. Then we'll examine their ears. And these are little cones, and we have different sizes for different animals. And they'll actually look inside each ear, down to their ear canal, and then at their drum, just to make sure that everything is normal. They don't have any sign of infection or growths or any debris in there that needs to be addressed. Good boy, Jack. Good boy. I know that's itchy, very itchy. And then I'll actually take a listen to their heart and their lungs. So we use our stethoscope. Good boy. Make sure that their heart sounds normal, there's no murmurs, no arrhythmias, which would be an abnormal beat to the heart. And then we'll listen to their lungs. Make sure we don't hear anything abnormal there. Good. And then the last thing we do, if it's a male dog, we'll also do a rectal exam. So we'll put on a glove, put some lube on, and check and make sure that their prostate and everything feels well and normal as well. So thank you very much, and this is what we usually do for a wellness exam.